Something I did want to mention, in case not a lot of people know, is there is something called medical emancipation. And so as a young adult, you're allowed to get advice, get help about any sexual health, anything related to drugs, alcohol, anything like that without your parents' knowledge, because that's considered medical emancipation. So if you did want to go to a clinic and say you're just not comfortable talking about it with your parents, you're able to do that under the medical emancipation law.
What are some of the fears that you hear people talking about around just empowering themselves with knowledge and health, and like the barriers that can come up, and then solutions that you as medical providers are encourage them to like take advantage of?
Yeah, I think at this age, a lot of the questions that young people have, I think, are absolutely great questions. You know, they're really curious about what it is that's happening to their body, and they're not afraid to ask questions, as opposed to older populations where, you know, there's a little bit of like timidity and like just trying to like hide behind a wall. I think a lot of the fear in that population just comes with, oh, what will my parents think, or what will my friends think, or how does this affect me socially rather than personally? And then that's why I really wanted to bring up the whole medical emancipation, because whatever it is, whatever healthcare you get, that is your right. That's your privacy between you and your physician. Just like that's the same way between you and like a psychiatrist or psychologist. So it's nothing that ever has to be like shared or, you know, divulged out into the world or anything. So you should just be confident and feel like I'm going to get the best care for me with my provider.
When is like the average time when like a woman knows that they're pregnant?
I think that varies for a lot of women. I think it depends on if you have regular periods or not. Because if you don't have regular periods, you honestly might not know for months, because you're just like, oh, well, I never get periods every 3 months anyway, so this missed period doesn't really mean anything to me. If you're somebody that gets periods very regular, you might know sooner after that first one, because you might be like, it's kind of been a week, and so you might take a test if you feel like you're at risk of pregnancy. But I think a majority of women know, honestly, around 8 weeks, 6 to 8 weeks, especially if they're not actively trying to have a baby. Because of course, if you're trying, you're taking tests more consistently and you're doing all the other measures. But if you're not, it's typically around 6 to 8 weeks.
How do you know, when you are mature enough to be able to make decisions independently of your parents as it relates to your body? And this is just so we can kind of see all different perspectives. Anyone has a thought on that?
Yeah, I think that's such a great question, because it's as you get older, I feel like people still have that question. You know, I've seen people in their 20s and 30s that still call their parents about medical decisions. And so I really don't think, I think it sorely is that self-awareness that you guys talked about. If you are aware of the changes that your body is making, you're aware of the things that you're doing, I think you're perfectly capable of making decisions for your body. One, because it's your body, and you have to deal with the consequences of whatever decision you make. So I feel like you should always just do what you feel is right for you. And whether if you think talking to your parents is right for you versus not talking to your parents, I think that's all within your right and all within your decision. And so I think everyone should just do what it is that they feel is best for them.
So I have a question that I'm dying to ask. At my school, a lot of the students tend to focus on body image a lot. So I really wanted to ask, what does it mean when you experience excessive weight loss or excessive weight gain?
That's a really good question. And I feel like, oh my goodness, I could talk about body image for so long, especially now with social media. I feel like it's gotten worse and worse. And I think when you hit puberty, your body's just going to change. And something that I realized is that there's a second puberty. So when you're in your 20s, your mid-20s, your body's going to change again. And that's perfectly normal. I feel like with excessive weight gain and excessive weight loss, I think it really depends on like the time frame, and if you're experiencing any symptoms with it. I will say that there are some times where someone gains weight or lose weight really quickly. That's when we tend to get worried. If you feel like your weight is changing and you're not doing anything about it, like you haven't changed your diet and you haven't been like exercising less or more, I think that's something to be like, what's going on? And that's something that, you can talk to somebody about whether or not you need to go see a physician or see a provider. But I think as our bodies change and the hormones fluctuate and we figure out what it is that we like to do, and what we like to eat and things, I think your body's going to change, and that's fine with it. And I think it's just really important to just maintain healthy habits now and then continue as you get older.